So just to review, we met in 2020,
Yeah.
but prior to that, you had had a hip surgery,
That was 2016.
2016. Got better for a while.
Yeah,
Right.
got better. Was still having a little bit of
Yep.
issues here and there.
Yep. And then you had an acute injury. And describe what happened.
So I had fallen on black ice,
Yeah.
and had partially dislocated, and we had found out that I had blown out my hip capsule.
So that's what brought
That's
you
where
to
we
American
brought-
Hip
yeah,
Institute at that time.
exactly.
And that was in 2020 that you had the
Yeah.
dislocation? Okay. And then later in 2020, we identified that you had torn the labrum, the capsule, and the ligamentum teres.
Yeah.
And we went in and reconstructed all of the
three.
above. Okay. We did the surgery in 2020, reconstructed the labrum, the ligamentum teres, and the capsule, all three. And that successfully stabilized the hip. Can you describe kind of the difference in your symptoms from before that surgery to after that surgery?
Yeah, so right before that surgery, I felt like my hip could literally pop back out at any second.
Yeah.
And then after that surgery and all the rehab and everything
Yeah.
like that, it just is definitely really, strengthened everything, and it
Felt stable
yeah.
after that. So you've never, since that surgery in 2020, the revision that we did with those reconstructions, you've never felt that instability again,
Never.
basically.
Yeah.
And then in the past year, you had a little bit of pain that occurred, and we did PRP injections.
Yeah. And that really, really significantly helped.
So this is from the surgery, and at the time of the surgery, this is the first image, we saw that there was a radial tear of the labrum at the iliopsoas notch. So it was completely sectioned at that spot and was also torn at the chondrolabral junction. So here we see, this is dry scope. We can see chondrolabral junction tearing. Ligamentum teres was 100% torn. There was just synovium there. The wet scope portion, there's again that radial tear at the anterior labrum. And we can also see anterior to it, the capsule is just gone. So all we're seeing here is muscle, rectus femoris or iliocapsularis muscle there, anterior to the joint. So here we found two acetabular rim fractures, two fragments of bone anterior. We removed
two rim fractures.
Yeah, two pieces, right? Then this is our completed reconstruction. So we did a very extensive reconstruction of the labrum that came out beautifully, and there's another perspective of it. This is an outside-in perspective or a bird's eye view perspective of the completed reconstruction of the labrum. This is the ligamentum teres reconstruction. We used 2 points of fixation, dual points of fixation at the acetabular fossa. One is posterior-inferior and one is anterior-inferior. So the two anchors are both right above the transverse acetabular ligament so that the graft has contact with the entire acetabular fossa spanning across the inferior aspect of it, just above the transverse acetabular ligament. That gives it more surface area for healing to the bone. And then it's a triangle construct where both strands go into the tunnel in the femur. And then here we set out to reconstruct the capsule. This is the dermal allograft used for the capsular reconstruction. And then finally corrected the impingement. And impingement can play a role in creating instability as well. So he had mild to moderate cam impingement. The alpha angle was 62 before surgery, and after surgery it was reduced to 36 degrees. So we alleviate the impingement as well. Range of motion is really good. So we get to about 120 of flexion, about 45 of external and about 30 of internal. An O'Donnell test, so we're at about 70 of flexion, 20 to 30 of abduction, and here we can test internal and external rotation. And you don't have pain with that, but in addition, I can feel firm endpoints, which is from the ligamentum teres that we reconstructed. So overall, a really happy outcome now 5 years later after a terrible problem. A previous hip surgery, previous hip arthroscopy, followed by a partial dislocation event that spontaneously reduced, but in the process caused a tear of the labrum, rupture of the capsule, and a complete tear of the ligamentum teres. And with this triple reconstruction, we're able to restore stability and in a permanent way.